Hi, good evening, guys. This is Dr. Jenny, physical therapist and Dr. Physical Therapy, creator and founder of Balance and Fall Support Group and Physiogen PT and Wellness. I am geriatric clinical specialist. And today, for our Thanks God, it's Thursday, we interviewed our innovator specialist, clinical specialist, and also our physical and occupational therapist. And we also have academicians, coaches, and tonight we have Lizette Cloete. She's an occupational therapist based in South Carolina. She is the CEO and founder of the Think Different Dementia LLC, and it is a coaching and mentor and consulting firm for dementia. And we will learn more about her today and also to know more what is dementia. What are the different challenges of taking care of our families and with dementia and also our clients. So this is very important for our caregivers, for us physical and occupational therapists, our students listening right now, and to know what is dementia and how the dementia link to a fall, because studies have shown that clients with dementia has double the risk of falls. So let's get to know more. Welcome, Lizette.
Thank you, Jenny. Thank you for having me here. It's definitely a challenging subject, isn't it? Balance and dementia. They go hand in hand.
Exactly, yeah. And thank you so much for this opportunity. And without further ado, let's see what is tell us more about first about yourself. You're from South Africa initially,
Hmm.
you're based in South Carolina, and tell
Hmm.
us your practice. How did you, as an occupational therapist,
Hmm.
so how did you come up of after mastering the college and then coming up with consulting firm and why dementia?
Okay. Well, I'm gonna tell a story and then I'll back into my story.
Gotcha.
So our life's journey is like a flight, right? We have our time when we're before our birth, when we're on the runway. We have a takeoff, which is our developmental days. Then we have our life's flight, which is our in adulthood, right? We have ups and downs. We have kids. We have fights with our spouses, and then everybody is going to, eventually all of us are going to pass away, right? And so everybody has a descent. And what happens is that when people find out they have dementia, or they're first diagnosed with dementia, either they have it or they find out their loved one has it, it changes their lives overnight. It changes the trajectory, because all of a sudden you're on your final descent, right? Whether it's going to be a fast descent, we don't know, but we're all, all of us are ultimately going to pass away. But somebody who gets a diagnosis of dementia knows that they are nearing the end of their life, or they're having these changes come. And so people with dementia and their caregivers really struggle to understand this complex nature of dementia, and they tell me and they tell us that they've lost control over their lives. They don't know what to do. They feel powerless. They don't feel like they have any control over any of this anymore. It's happened to them. And we also know that people with dementia and people who take care of people with dementia, more than 50% of them have depression. And so between struggling with depression and all of these other changes, this leads to problems with their family members and their relationships, not even withstanding all of the other changes that you just have from dementia. So what Think Different Dementia, the company um, I created with the purpose of teaching people reliable information, because there's so much information on dementia out there in a lot of the groups that is not reliable. And then trying to teach people, one person at a time, actionable strategies that they can use to help make this journey easier for themselves, so that we can put the person with dementia as well as their loved ones back in the cockpit and in control, so they have some control over their lives. So that was why I created Think Different Dementia was to help come alongside people and caregivers with dementia to be able to help them in this flight and in this journey. So that's the story. Now the history, my history, part of the reason I probably ended up not ended up, because I think it was it was a purposeful decision to specialize in dementia, is that early on in my career, and I've been an occupational therapist for 28 years, so it's a long time. Early on in my career, I realized that a lot of physical therapy and occupational therapy were very focused on the physical part of it and not as much focused on the cognitive part of it. And people are more worried about going to a nursing home because they cannot physically take care of themselves. That's not really the reason people end up in a nursing home. It's because they cognitively cannot take care of themselves. And so over probably the last 15 to 20 years, I started to specialize in cognition and dementia care. And so, it truly has become a passion of mine to work with people with dementia and their care providers. My grandmother ultimately ended up passing away in South Africa, probably of dementia. She had later onset dementia, but I could definitely tell. And my mom had a stroke when she was in her early 40s and is 73 and has vascular dementia. So I have, all of this in. I had my passion for people with cognitive impairment, and it's just kind of everything just kind of flowed together to just become, the thing that I know the most about.
Yeah. Then I'm sorry about your you said grandma.
Yeah, it's
Mm,
hard. I mean, it's like I said, she had a stroke when she was in her early 40s, and getting older with an old stroke is definitely challenging, and she's had multiple things since then. But yeah, definitely can impact one,
that's
make your changes.
mm-hmm. So that's really good history, and also thank you for sharing that to us. So when we say dementia, it's really a challenging one, as you've said. It's
Mhm.
very complex. We know that it's like an umbrella, and it
Right,
is a very, very lots of definition that they keep saying.
right.
You talk about the vascular dementia, which is related with if you have history of stroke and other neurological cases. So tell us more for a simple term for our listener when they hear the word dementia.
Mhm.
So what is a dementia and some of the signs and symptoms that they can see and expect for their loved ones?
Mhm. So you mentioned dementia is an umbrella term. So it literally, the word dementia means out of your mind. That's what dementia means, out of your mind. So underneath the umbrella term of dementia, you have Alzheimer's dementia, which is the dementia that most people are the most familiar with. Then
Yes,
you have your vascular dementia, you have your things like Lewy body dementia, which comes with Parkinson's and stuff like that. And then you have frontotemporal dementia and you have mixed dementia, all of these different types of dementia.
yes.
But really, the thing where I think your listeners need to what I'd like to share is there's a big difference. The first thing we think about when we think about dementia is memory loss, right?
Mm-hmm.
That's typically
Yes.
the first thing people say. Well, um, they're having trouble with their memory. There's kind of two things. People are forgetful, and normal forgetfulness is normal.
Yes.
And then there's losing your memory, inability to make new memories, and they are totally different things. So when you're forgetful, and the difference, just a quick example of a difference between being forgetful and having short-term memory loss is, like, if you forget, like, I come home, I'm busy, I'm distracted, and I throw my car keys down where I don't normally put them, right? I always put them in the same spot, but for that particular day, didn't put them where I was supposed to.
Mhm.
And you're like, you get up the next day and you're like, okay, well, where are my car keys? Where did I put them? And you look everywhere that you normally put them and you cannot find them. And then you stop yourself and you take yourself back and say, well, I came home from work. I know I had the keys in my hand. And you take yourself step by step through. And then it's, oh, yeah, they're here. That's forgetful, right?
Yes, yes.
The difference between that and memory loss is you and I are having a, conversation on the phone about, going to the movies and what we're going to do and what we're going to see and everything. And then at the end of the conversation, I put down the phone and you call me back and say, what time were we going to meet? And you say, well, and I say to you, you didn't just call me, because I have no recollection of having had that conversation. That's memory, like not being able to form new memories. It's typically one of the first things that we see. It's not necessarily the first signs of things that we see. There are other signs. A way that I describe it when I talk to people is that, we start with what we call the subjective, right?
Yes.
I think I'm having trouble remembering something, or I think I might be forgetting something, but if I take a test, it doesn't show that there's something wrong. I'm subjectively having trouble with my thinking. Then you have mild cognitive impairment, which is
Yes.
not dementia. It's the step. It can turn into dementia, but it's not. But that's the step where people start to take a test, and a test is showing they're having trouble.
Yes.
And dementia doesn't just impact memories. It's the one thing that people find, can put their finger on the fastest, but that's not the only thing, right? And then you have your mild dementia, your moderate dementia, and severe dementia, and that's, truly there's a line
Mhm.
below and above that. And so the biggest takeaway, I think, for people tonight is, don't ignore thinking changes
Mhm.
just because we're afraid of it, because there's such a stigma
Mhm.
to trouble with your thinking that people don't want to address it. The sooner you find out and the sooner you get help, the sooner you can make changes that can help you. The longer we wait, we always say this for a stroke, but it's true also for
Yes.
dementia. Time is brain. If we don't do things early on, we can't change the outcome of it. There's a lot of research showing that there are things we can do to prevent dementia. And so by waiting, we've lost our window.
Yes.
So don't wait.
Good point. Good point. Especially we know that dementia is a progressive disease as well.
Right.
And then I love when you said that when you see the different signs and symptoms, we really need to know. So the question is that if you have a family member and the caregiver and the family doesn't know when is the right time that they need to look and ask for some help.
Well, I think the sooner you recognize it and start to ask for help and get testing, the better. The challenge is people people when they're in that phase themselves, um, don't necessarily realize that they're having trouble. So it's very difficult to get them to be able to agree to further testing. Um, the reality is, when it's starting to impact people's lives
Yes.
and their ability to and their relationships, right? If And that's where we start to see a lot of the stuff come out, is when people are starting to lose the quality of their self-care. They don't want to
Yes.
take a shower anymore, or they've gotten lost driving, or they wander away from the house. A lot of times we start to see people asking for help way too late in the process, when
Mhm.
there were a lot of things that we could have been doing to help them as physical therapists and occupational therapists early on.
Yes.
Falls early on. There's a very high incidence of falls with people with dementia, and
Mhm.
it was really funny. One day I had a doctor I worked in acute care, I work in home health now, and the doctor came into the room and he said, well, he doesn't, he's like, why is he falling? I said, because he can't think. He's like, it's not his balance. I'm like, no, there's nothing wrong with his balance.
Mm-hmm.
It's not his inner ear. It's not his mechanism of balance. It's he's making unsafe decisions and sees the chair and sits down 4 feet in front of it, and that's why he's falling. So falls are highly it happens significantly in people with dementia. And there are two factors, I think, that happen for falls with and
Mm-hmm.
balance with people with dementia is you have your physical changes
Mm-hmm.
that are
That's right.
occurring. As the brain is shrinking, it impacts your balance and systems. But then you also have the poor decision making, right?
Yes,
And the poor,
cognitively, yeah, as you
right,
said.
the cognitive component of it.
Mm-hmm.
So that's the part that's harder to affect to change, because yes, strength will help your balance. Yes, balance exercises will help your balance. Even if you're further along in a dementia process, you can help prevent some of those falls by just being stronger.
That's,
But you
mhm.
have to have the other part of it in order to prevent that fall.
That's wonderful. That's true. Dementia, guys, is not a normal part of aging.
No.
And such as falls is not a normal part of aging. Evidence-based, really, that they link that dementia with increased fall risk. And that's a good point when you say that, Lizette, especially when you say that cognitively, physical changes, there's a plaque formation, that's there also
Right.
some shrinking there, and also that's happening. So it's very important that they regularly exercising,
Hmm.
So what are some, because when we do exercise and increase the flow, oxygen buildup, things like that, and we can delay the process. Dementia cannot
Right.
really be gone, but we can delay the process and make them still functional. You talk about their self-care, their ADLs, and as a physical therapist, occupational therapist, you are occupational therapist.
Mhm.
So how do you help your clients? So explain to our listeners first. Some of them, they always still ask the patient, I'm a physical therapist, and then my OTU is coming, so I do the eval first.
Mhm.
Why do I need another therapist? I have you. What's the difference? So what is the easiest um what's the easiest explanation for that? What is an occupational therapist, Lizette? And how the OT can help, especially our dementia clients?
Mhm. So in cases of dementia, um, there are three things that you always, and this is what makes occupational therapists the what's the word I was looking for? The
Go to.
specialist in this particular, physical therapists. I would much rather have you guys do the balance stuff and so on. But like I work in home health. I know you said you work in home health.
Hmm.
Like an occupational therapist like myself, the benefit we bring to the table in um, with people with dementia is we look at three things. There are three things that have to align. So if you take a Venn diagram, right, you have three overlapping circles. You have the person with dementia, and you have their care provider, and you have the environment. And the occupational therapist is the specialist in modifying that environment to look at the environment that the person is living in, to be able to change it, to optimize the person with dementia's functioning, as well as look at the care provider, the person who is helping that person with dementia, because frequently when people are having trouble with dementia, the thing that we hear the most about is challenging behaviors, right? So
Yes.
behaviors have um, always so a behavior when a person is demonstrating a behavior, they are trying to communicate something to you. They are trying to tell you that I'm tired, I'm hungry, I'm cold, I'm scared, I'm bored, I'm overstimulated, something.
Mhm.
A behavior is always trying to communicate something, and it's our job as the people around the person with dementia to figure out what they're trying to tell us, right?
Yes, yes.
So there's three factors that can play in. Is it something with the person? Is it something that the caregiver did, said, thought they might have done or said, or could have done differently? or is it something in the environment, or is it all three? And
Mm.
so an occupational therapist like myself who specializes with dementia, I will go into that person's environment and I will start modifying the environment.
Yes.
I can't change that person necessarily. There's a difference. At the beginning, you can still do rehabilitation. You can change them. A person with dementia up to a certain point can still learn
Mm-hmm.
new
Yeah.
information. But when they get to that point where they cannot, I cannot facilitate a change. I can't teach them to use the walker right. I can't teach them to use a strategy, but I can change the environment to keep them safe, or I can
Yeah.
change how the caregiver approaches them to keep them safe.
Exactly.
So that is what I do as an occupational therapist, which is not necessarily the norm of occupational therapy, but that is certainly has always been my approach, is to look at those three things and then change what I can in the environment and teach the care provider how to better communicate with the person with dementia.
Awesome. Yeah, wonderful. So that's really, really great. Especially, we always talk about that. I told to my clients that, all right, I will take care of you. I'll do more on your strengthening, balance exercises. We focus more on your legs. We will walk, strengthen your balance. But it's very important that you have an occupational therapist. I really want my colleagues to come over, especially safe home modification, as you've said. They have
Hmm.
really great also in their ADLs, their functions, self-care.
Right.
I believe it so much with the occupational therapists, their mind, your ideas in modifying these gadgets. You're like having this, okay. So, and also caregiver education, as you've said.
Right.
So I even ask them always, every time I'm seeing the client, I want them, the caregiver, to be there, because every time you educate them and they will learn, because they will going to continue your exercise, right?
Hmm.
So what are the most common questions of your caregivers that
Ooh.
you always educate them? This one, oh, my mom really has, she doesn't want to shower. What will be the best technique to do this? She will ask me like that. So what do you recommend on those cases and questions that you've encountered?
That is a very good question. So every person's unique, right?
Yes, exactly.
So that makes a question like that so difficult to answer, because you literally have to know everything. Like if somebody says to me, my mom doesn't want to take a shower,
Mm-hmm.
the first thing that goes through my head is, how old is mom? Did she ever have a shower did she ever have a shower before? When she
Yeah.
was growing up, did they
Mm-hmm.
take sponge baths or did they just bathe? Um, because a lot of people don't, when they're growing up, if they're 90 years old in 2021, they didn't grow up with a shower. They didn't have a shower. They sponge bathed, or they took a tub bath. They never showered, right? And so if somebody's going through a process of dementia, now we are putting them in a shower. Okay, did they have a near drowning? People
Oh,
with people
mm-hmm.
who have had
Traumatic.
trouble, yeah, a traumatic event with water, don't put them in a shower. It freaks them out. Are they cold?
Yes.
Are they afraid? Is the bathroom all white and they can't tell where the surfaces are, and they're afraid they're going to fall? There's so much
Mm-hmm.
just in that question to unpack regarding what's going on. So it's not a blanket answer. It's kind of like,
That's
I say,
true.
you got to be a dementia detective. You literally have to start to write it down and say, is it every time? Is it every time they want to take a shower? Is it only sometimes? Are
Mm-hmm.
there different care providers? Is it different time of day?
Yes, I'm about to say that
are
too.
are they cold? Is what's going on?
Exactly.
Because just saying somebody's reluctant to take a shower is that that's like a 4-hour conversation right there.
That's true.
Be- because
Especially,
it's
I
very
like
specific to
I
each
like when
person.
you what I like when you say that it will be like history taking is very important, and the
Right.
person that is really more involved in the client and knows the client very well should be there,
Right.
because they need to tell us what are the usual practice, and then also what works best
Right.
with this
Because you want
particular
to
client.
Right. Because you want it, because maybe, like, for example, maybe one time she takes a shower, no problem. Well, what was different that day? What
Mm-hmm.
time of day was it? Who did it? Was it, what were the different factors regarding when they, why it was successful that day versus another day it wasn't successful. So each person, you really have to get to know the triggers. You've got to figure out
Yes.
what's triggering each person's behavior. And then the thing, this is always something that is a hard conversation to have, especially with females, with
Mm-hmm.
female people who have trouble with their thinking. And this is something I don't think we often think about, but we never know what kind of experiences they might have had as a child that they
Oh,
never told anybody. There are a lot of women who have been abused or sexually molested as a child, never, ever, ever said it to another person in their entire life. And then you come help them with these really, truly personal things, and they
yeah.
totally, they cannot communicate that with you anymore. So we want to be sensitive. And I always tell people, just remember, you can get clean without taking a shower. If a shower is, if the bathing task, a shower is so traumatic for everybody,
Mm-hmm.
then we can get clean other ways. We don't have
Yeah,
to put
there's
mom in the
lots of
shower.
ways. Huh?
Yep.
And especially if they're not always going out, and it
Right.
depends on what to focus. If they're incontinent, focus more there, and then
Right.
focus on all the areas that has more smell that might be at risk
Right.
for any fungi, for just to focus on that area. So that's wonderful. You say about communication. So
Hmm.
what are your advice? We have listeners, let's say we have clients here and caregivers. We have the diamond. So I'm sure there's some clients that become forgetful, maybe stage 1 to 3 dementia. But how about our caregivers listening and our students? What do you recommend the way of communication? I know that it should be short,
Hmm.
simple commands, and should be like calming, so they will
Right.
not be threatened. So what other advice that you can suggest to us?
So I frequently, this is probably the thing I tell most of my patients, probably the most frequently, the caregiver of the person with dementia, is be careful in the words you choose. Because we have a tendency of, when we have somebody with dementia, like if I ask you, Jenny, do
Mm-hmm.
you want to take a shower? Right?
I just say no.
Right.
It's a
I
short yes or no answer. As
right.
every
I
time
gave
I
you
say no.
right. I gave you a choice. I said, do you want to? You
Okay.
don't want to ask, do you want to? You want to you want to say it's time for us to.
Okay, I like that.
Let's
Mm-hmm.
go do this. It's time for a shower. How about we go here? Not, do you want to
Yes.
go change? Because when we use the words, do you want to, a person has the choice then to say yes or no, right?
Mm-hmm.
So frequently, if you just change even just that phrase, instead of saying, do you want to take a shower? Say, hey, mom, it's time to take a shower.
Yes. You give
Let's go take a
direction,
shower.
you give the
Yes,
idea, and then
right.
you're telling, explaining exactly that this is the activity that we're planning to
This
do.
is what we're going to do next, right?
Yes,
Because,
yes.
for example, I always tell people, we're not comparing somebody with dementia with a child, but they become very childlike, right?
Mhm.
And so when we have a 3-year-old child, right, we don't allow them to make the decision whether or not they're going to get bathed. It's
Mhm.
time for your bath,
Yes,
right?
because we know that it
Because
is,
we
she
know,
will benefit with that shower for
right,
this time of the day. It's been like 3 days, things like that.
right. And then you just bring up time of day. Routine.
Okay.
Routine is a
Mhm.
person with dementia's friend. The more consistent routine you can have, the better the flow of the household's going to be. If you get up at 10 o'clock one morning and 4 o'clock the next, there's no rhythm in the house. You want to do the same thing every day, the same sequence. You want to keep it in a very structured routine, and that tends to help, balance a person out. And sometimes I reflect on this a lot. That's one of the biggest differences between a facility, like a
Mm-hmm.
person in a facility, and a person at home, right? The
Okay.
facility has a very strict structure, a very structured routine, and people in a facility fall into that routine.
Mm-hmm.
They're not allowed to, everybody gets up for breakfast. Everybody's got to be in the dining room, have their food. There's a set routine. And people with dementia really thrive on a set routine. When they go home and the fabric of our life is then back in and there's no routine, everything starts to fall apart. So try, in communicating with people with dementia, the more we can keep a routine, that'll help it when you try to communicate with them, because then they'll know exactly what to expect. Because if it's vastly different every single day, they have no idea.
Great point. Yeah, that's really true, especially the facility. Let's say they have families in at home and they have this caregivers that's coming. The
Hmm.
challenge is there is that some agencies keep changing the caregivers. That's
Right,
another challenge there. They want special familiarity with the same person. As much as possible, we want the same person taking care, same
right.
therapist as much as possible, not changing from one therapist to another because everybody has different style, different
Mhm.
techniques. So, and it's very difficult for them to be more engaged with one for a few days and then you will suddenly change
Right.
again. And it's another, um, what do you call this? Also for the caregiver. It's very
Hmm.
difficult for us clinicians to know her style, know her technique,
Hmm.
then endorse again. So that's good point. So how did you ended up improving yourself? Let's say, what do you recommend for us, like books or courses to,
Ooh.
especially for, let's say, for um, caregivers? What do
Hmm.
you think is the best for them to check? What references and organizations that you recommend, and also your idea and your books, if you have a book or your
Well, I'm in the
recommend.
process of writing my book.
That's wonderful.
It is going to be
Congratulations.
called Dementia Made Simple.
Uh-huh. I like that. Mm-hmm.
I do too. Um, so probably a good book to start with is called The 36-Hour Day. That really is a good book. It's very even for me, and I've done this for a long time, it was very overwhelming to read, and but it has a lot of information in. So it is a very good book, but you've got to be able to take it in little pieces, so as not to get overwhelmed. Um, I have a Facebook group. It's called Think Different Dementia, where
Mm-hmm.
I've really started to try to. It's a small group. We're about 250 people,
Mm-hmm.
and my purpose behind the group is education.
Yes.
Um, so what I'm trying to do in the group once a week. Tonight was a total flop because I tried something new. Adults learn by making a mistake, so I won't do that again. Um, but I'm trying to put educational content on there. I'm doing presentations and Facebook Lives and answering questions.
Wonderful.
People can message me. I actually do a lot of messenger, have people message me and I will answer their questions. So that's where I would start. Um, a lot of support groups, a lot of the larger support groups, I think are helpful. You've got to be careful on them. They're 23, 24, 40,000 people. You don't know what the person, what their background is. So I read a lot of the stuff and I'm like, I can't overtly say this is not accurate information. So
Okay.
you've got to temper it with, it was what was helpful to that particular person who answered the question, but that doesn't necessarily make it reliable.
Mm-hmm.
Um, I want to caution people about always just taking the advice on these large groups, and you need to have a good care team in place.
Mm-hmm.
You need, and all physical therapists and occupational therapists are not made the same. You need to find therapists that truly understand and know
Mm-hmm.
how dementia works.
Mm-hmm.
Find somebody who is a certified um, in dementia to be
Mhm.
able to walk with you through your journey, because it is not the same. Every person is different, and every person's journey is different. But people who understand dementia can help you walk through that process and help you with it. So those two things, like the 36-hour day, and then hopefully by the end of this year I'll have my book out, and then
Congratulations. That's wonderful.
join my group Think Different Dementia if you want to
Yeah.
know more.
Yes, that's wonderful. Thank you so much. And then you know what, Lizette, I also advise, I speak with one of our summit before, and then my topic is dementia. And this is for the students in Philippines, and it is like an donation. So
Hmm.
whatever on that, we call it Home Health Summit. And then my topic is dementia. And then I told them how important is music, you know,
Yes.
music therapy for our clients, and also wonderful. You will see that I have one cases that she has dementia, and she loves this what do you call this, like con I forgot the theme, but she has particular brand of music. And then
Hmm.
that's why therapists, if you will have a dementia clients, always go back to the caregivers.
Music, right.
What mom's like, what does she doesn't like, so you will prevent this mistake, or else she doesn't love you
Hmm.
forever. And then so try to know what they want best, and then this is the one. So I check that particular music. If she loves Elvis Presley, hi Mrs. Smith, can we walk together, and then we'll dance together. And then I have this Elvis. Your daughter Samantha, let's say, told me that you love Elvis. Oh, okay. I love Elvis.
Yep.
And then I have always my phone, because I keep using
Yes.
always my phone for
Yep.
my dance,
My music.
balance.
Yep.
Yeah. So I just choose upbeat music if she loves upbeat. And then, if they love relaxing music, they will put relaxing music. So that's really wonderful. We need to know exactly what they want. And then,
Hmm.
so that's really wonderful. And also another one that we can give a tip. We follow your communication, you said, right? We want to communicate well. I love the idea of rephrasing the words. And that's a really good point. For me, I've learned when I was new here, follow the 90-second rule. So,
Yes.
yes, they said, what's the 90-second rule? So, always ask first simple question, and then make it just wait 97,
Hmm.
because you cannot really ask again and then again. She's still trying to comprehend what is your first question. So that's
Yes.
what I said, 90-second rule. So that's really good, and we always want to learn more from you. I hope you can speak with us in our group,
Oh, I'd
do
be happy
some,
to.
yeah, do some, and then we can educate them live on that particular day, so we can
Yes.
connect with you, all right? Because I'm
Yes, ma'am.
sure we have clients, caregivers, and this will really helpful for us therapists as well. Our
Yes.
Filipino therapists. We have listeners from Philippines, as you said. You have many friends also from Philippines. We are all over different states, and we can. I will also going to share this to my own page, which have many listeners, such in different places. I work in United Arab Emirates, so I have friends from there. So they are therapists to Saudi Arabia. So thank you so much.
That's
So
amazing.
thank you. So where they can connect with you, Lizette, tell us more. How can we contact you about your company? So
So
consulting.
the easiest is just my email, which is thinkdifferentdementia@gmail.com. Not hard. Thinkdifferentdementia@gmail.com. People can Facebook friend request me as well. I'll more likely accept it. I'm getting a little more particular these days because I'm getting a lot of creeps out there. But people can message me. Just message me by my name. It's Lizette Cloete OT. I'm the
Yes.
only one out there. And if they message me, then I'll answer a question, and then I'll at least know people are legit. But the easiest is thinkdifferentdementia@gmail.com.
All right. Thank you so much, Lizette. That's wonderful. I agree with you. We have many now, like invitation, and you'll never know if they're really legitimate. You will notice that they are really, you need to go back to their profile,
Oh,
because
yes.
I've noticed that I have many invitation recently and joining some of the group, and we are
Yeah,
private,
I'm,
and then I have more than 30 declined, and this,
yeah.
there are beautiful faces, and this particular beautiful
All
faces
the same
has the
face
same
over.
faces.
Yes. And
Did
that's
you see
been
that?
recent. Yeah.
Yes, yes. And then they have link, and there's a link with the TikTok. And then so I said, and these are only like 5 pictures, you know.
Mhm.
So it
Yeah.
means, guys, and there's lots of more videos from TikTok. So these are like only maybe fishing or um scam, because they are maybe doing something, or I'm not sure. But they're definitely how you can gauge if this particular invitation is legit. You need to check the profile, or you know your instinct. And good luck. So think different dementia with Lizette. If you have any questions,
Yes,
and we
please.
really appreciate you, you help a lot, and your professionalism help us to be educated, share to our students and also our caregivers. Thank you,
Well, thank
Lizette,
you.
and we will
Thank you for
connect with
inviting
you.
me.
Oh, my pleasure. We really applaud all our clients and our clinicians. I mean, doing these wonderful things and doing this educational, you know.
Hmm.
So we always give, and then they said that education is the best service. And then you're doing that already because you keep educating us, everybody, clients, clinicians. So that's awesome. Thanks,
That's the
Lizette.
goal. Thank
That's
you,
the
Jenny.
goal, as you said. That's the goal. Educate, educate. So, guys,
Yes, ma'am.
this a wonderful, another wonderful. Thanks God, it's Thursday. And if you have any questions for us, just connect with us. So we have Balance and Fall Support Group in Aging Adults. Remember, we dementia is not a normal part of aging. Check her Facebook group, Think Different Dementia Facebook group, and also many also support group there. We have dementia care, Alzheimer support group, but be careful on what you watch. What so you check with professionals, okay? So what works with other people doesn't really works for your family. So you need to connect with your doctors, your primary care, especially if they're suggesting medication. So be careful so it doesn't work. If there's a drug interaction, if they recommend this works for mom, cannot be work for dad, just like that. Okay? Connect with professionals. Physical therapy, occupational therapy is a good, wonderful tool for your mom or dad with dementia. Exercise. The more exercise you do, such as mind games, you know,
Mhm.
chess, Scrabble, crossword puzzle, Sudoku, anything that makes her active, makes her mind very, very. I just played with my daughter a boggle, and she's really doing better and better. I see something, she sees lots of things that I didn't see, and she's doing a word brain on her phone. And I said, that's getting better and better. And I'm always winning with boggles before. So that will work well with your mom and dad. So good luck, guys, and always connect with us. All right. If you have any questions, just connect with us. It's me again, Dr. Chenny. Thank you for listening with us tonight. And connect with us with Physiogen, PT and Wellness, and Balance and Fall Support Group. I'm your geriatric clinical specialist. Lizette here is our dementia specialist, and we would like to help you. All right. Take care, guys, and God bless.
Thank you. God bless.
Thank you, Lizette.